You heard about labor induction before, and what is your perception of labor induction? I'll tell you mine. About 5 years ago, I was pregnant with my first child, and I was getting to that point where I was about to be overdue, where the pregnancy was about to be overdue, and so we decided that my care provider and I decided that, of course, with my husband, decided that I would go in for induction, right? And for me, I never wanted induction. I wanted my labor to be spontaneous, to happen, to come on its own. But let me tell you, for most persons, the first pregnancy labor don't come spontaneously, right? So if you're in that space where your care provider is right now giving you the option of labor induction, there's nothing to be afraid of, all right? I went in for the labor induction and I went into labor at the second attempt, and the labor progressed and I had my baby. Everybody's fine. This year he clocked 5 years. And so if you're listening to me right now and you're scared, you don't know what the outcome of labor induction is going to be, this is me telling you to trust your care provider. Provided you're sure that your care provider is experienced and is good, then there is nothing to be afraid of, all right? There is nothing to be afraid of, except you have other concerns, which of course you should go ahead and mention it and have it ironed out, all right? I am Chomo Okoli, the founder of the Expectant Parent Academy, and today we are discussing labor induction, what you need to know as a pregnant mom. And if this is your first time coming across the channel, go ahead and hit the subscription button. This is where you want to be. Every Wednesday we have conversation about pregnancy, and then Monday and Fridays we have conversations to help you nurture your child in the first 6 years. So we're not just walking you through pregnancy, we're also going to be here to hold your hands in the first 6 years of bringing your child up. So go ahead and hit the subscription button and go ahead and subscribe and hit the notification bell. You will be notified every week that any of our uploads come on. All right. So there are I'm going to share with us about 5 reasons why we get to the point of labor induction. Right. Number one is when your pregnancy is approaching, is overdue or is approaching being overdue. Right. And being overdue would be defined by your care provider. I've noticed that across um, different areas or different settings have their own definitions of being due. In some settings, the care provider will say that once you're 39 weeks and about 6 days, they wouldn't want you to enter 40 weeks for some reasons. And some others would allow you go as far as 40 weeks, 41 weeks. But what is important is that you work with your care provider. It also gets to the point of trusting who your care provider is. All right. And then the second reason is for reasons of maternal or fetal health. So if your care provider observes that the mother's health is not so stable to allow the pregnancy to continue. For instance, in the cases of preeclampsia, inducing your labor could come in as an option. Or in areas where there is a reduction in the fetal movement and growth and all of that, inducing your labor, offering you induction of labor could come in as a result also. Then the third reason why you could be offered induction is when there's been rupture of membrane. That is, your water has broken, but you're not contracting. All right. Another reason is that you've gone into labor, okay? You've gone into labor, but the contraction is not adequate. All right. So in this case, what they do necessarily is to augment your labor. And then the fifth one is other reasons that your healthcare provider, based on your history, that your provider now comes up with the idea that inducing your labor or going into labor induction is an option for you at that point. All right. So what is the implication of labor induction? At the point of labor induction, the goal is to bring out your baby. All right, the goal is to bring out your baby. And so if the induction progresses, labor comes in and continues. But if the induction fails, it means that you have to go in for a cesarean section, right? Remember, like I said, the goal of labor induction is to bring out your baby alive and healthy. And so that should be one of the things you should hold on to when you're when the conversation about labor induction is coming on. Okay, so the target in labor induction is to get about 3 to 5 contractions in 10 minutes. I'm mentioning this so that when you consent to it and you eventually go into it, depending on the environment where you are, you can also be a part of the count of what's going on. So when the contractions is becoming more than I say 3 to 5. So when the contraction is becoming more than 5 in 10 minutes, you can notify your care provider so that they can regulate whatever technique that your induction um, is going on by. All right. So there are techniques of labor induction. The first is the use of prostaglandins. These are artificial prostaglandins in the form of drugs that can be inserted into the woman to a sort of help to ripen the cervix so that contraction could start. The second one is the sweeping of membrane, which is usually the first anyway. Now, this is a procedure that your midwife or your obs-gynae would have to, perform on you. The goal is to stimulate uterine, to stimulate cervical activity, and also to see if it could trigger labor. And the third one is this of pitocin. This particular one is done through use of infusion. The drug is put into infusion and it's regulated to achieve this. So in labor induction, it's not something that ordinarily every pregnant woman look forward to spontaneous labor, especially if you've not opted for cesarean section upfront, right? However, it is not the experience of many people, especially if this is your first pregnancy. And I can say that with my own experience. I'm a mother of three, and my first child, I was induced, but the last two came on their own. And so, if you're listening to me, and especially you are a first time mom, it's fine, right? There's nothing to be afraid of. Once your care provider is experienced and is good um, in caring for pregnant women, then there's nothing to be scared of. All right, I hope this allays your anxiety and gives you the hope that actually going in for labor induction is, you know, taking you closer to be holding your little one in your hands. And that's amazing, isn't it? All right, so thank you. I hope you've been able to get the information you need to make up your mind and consent to labor induction, especially if you're pregnant and you're term and this conversation is something you're having with your care provider and you're afraid and scared. This is me saying, calm down. It's okay, but then it's something that you can go through and the results will still be fine. All right. I wish you a safe delivery and I wish to hear from you soon. If this helps you, do let me know in the comment section. You know another preggy? Go ahead and share this video with them. All right.